Good morning, everybody, and welcome to Tuesday Talk. We have a really exciting agenda this morning. We are excited to welcome Steve Ballmer, CEO and President of Leading Age, who has a great message to share with us. But to get started, I'd like to turn over today's meeting to Mary Mackey, our Regional Vice President of Operation, who is joining us this morning. Mary?
Thanks, Brant. Good morning, everyone. Sorry I cannot attend the Tuesday Talk in person, but I wanted to share some news with you that, and let all of you know, all the residents and the staff, that I will be transitioning my responsibilities as of the 1st of April to my colleague, Sherry Robinson. Let me tell you a little bit about this decision. The decision was made to even up the workload between the two regions. I have been overseeing 8 communities, and Sherry at this point has been overseeing 5. So with this change, she will take on the responsibilities of Regency Oaks, and she will have 6 communities, and I will continue with 7. This is just a focus to give Regency Oaks more time from a regional team. So along with Sherry is Amy Waugh, and everyone knows Amy and loves Amy. Amy is the regional sales manager. She works closely with Sherry, so you all will welcome Sherry and Amy to the community together, along with Angie Ike, who's the regional director of clinical services. This is not a change to do anything but enhance more opportunities for interactions with LCS associates in Regency Oaks. Regency Oaks is a premier community, an outstanding community, a community that has so many attributes because of you, the residents, and the staff, and of course in the leadership of Brant Spence. So this is going to continue your great traditions and the results of your community. I myself will be back from time to time because I'm sure that there'll be meetings and parties and events and that great town hall reopening that I look forward to participating in. I assure you that you're in great hands with Sherry Robinson, Amy, and Angie. Sherry has a very similar background to me. She's been in the CCRC business for many, many, many years. She has been with our division for 8 years. You will certainly enjoy getting to know Sherry, and I know you'll welcome her with open arms. I will miss you all. You're a wonderful, wonderful community, wonderful people, and you've made a big difference in my life, and I thank you for that.
I just want to let you know I am trainable. I took off my mask and I'm speaking into the microphone. Before we watch this wonderful video that Flicker Headquarters has provided to us, I wanted to thank Living Age for their help in managing people at the executive level that allowed all of us to experience a very successful, error-free vaccine deployment. So thank you very much for your help. And I have one other housekeeping. I want to take the opportunity this morning to announce that Pat Gogolewski has joined the Flicker board, and we're very fortunate to have her. There she is in the back waving at me. 35 years in the realty business, owned her own realtor, as well as sat on 2 different realtor boards. So I would say she's very qualified to join our merry band of warriors. One last thing before we look at the video is I wanted to point you guys to the first quarter newsletter. Page 6 in particular.
I'll go, please.
Page 6 in particular, it says, when I get to page 6, prepare now for the coming shift in resident engagement. And it's talking about 4 dimensions, key dimensions: having a voice, well-being and security, purpose and fulfillment, and inclusion.
In addition, if there anyone who wants to make donations to help any victims, please do so at this time through the Fallen Heroes Foundation. The Fallen Heroes Foundation. Robin and
Andrea Robin and Andrew are going to tell me I took too much time, but I'll take that. Anyway, I would encourage everybody to read that, and if you're not a member of FLICRA, which is the minority here in this room, please see Tony Camasta or Mike Murphy, and they will help you sign up for this. There are 12 key metrics, and I believe that a lot of our committees and teams are doing these now, not to say that we can't improve, and also everything I needed to know in life I learned in kindergarten. Robert Fulcrum, number one on the list is share. So we need to share across committees our successes and triumphs. So that said, now we can start the video.
You have many important choices when it comes to retirement living and how you can achieve your long-term care objectives. Continuing Care Retirement Communities, also known as CCRCs or Life Plan Communities, are a great option chosen by hundreds of thousands of seniors across the U.S. Florida alone has over 70 CCRCs with nearly 30,000 residents like you. The state legislature, regulatory agencies, providers, and lenders all play a part in making decisions that affect your long-term care. And as a resident, your voice needs to be heard. In Florida, you are represented by the Florida Life Care Residents Association, also known as FLICRA. Since 1989, FLICRA has fought to protect the rights and advance the quality of life of CCRC residents. FLICRA is a grassroots organization with over 14,000 members that is made up of local chapters with their own locally elected, resident-led, volunteer board of directors that carry out FLICRA programs and services within their community. FLICRA works collaboratively with locally elected resident councils within each CCRC to ensure that council members are aware of their legal duties to provide a recognized entity to serve as the interface between residents and management within each CCRC. The association has fostered collaborative relationships with groups of community providers such as Leading Age Florida and the Florida Senior Living Association in order to ensure an open dialogue. Florida regulators have considerable authority to oversee general operations and actively monitor ongoing financial trends of each licensed community. Because long-term care is always such an important topic in Florida politics, FLICRA is active in the state legislative and regulatory process to ensure the protection of your best interests. At the state and local level, FLICRA has a strong brand identity with state legislators, regulators, and the media. FLICRA works closely with state regulatory agencies, including the Office of Insurance Regulation and the Agency for Healthcare Administration. FLICRA seeks to maintain a balanced approach of protecting residents' rights, while at the same time advocating against extraneous costs on residents. Unlike most organizations with political action committees that make large campaign or political party contributions, FLICRA's success comes from the fact that our members are actual users of long-term care services. FLICRA doesn't exist without you. Legislators listen to you. You vote. By nature, FLICRA members are active voters, hosting state legislators for town hall meetings and testifying at local county legislative delegation meetings. You represent not only yourself, you are giving voice to those who may not be able to act on their own behalf. FLICRA's consistent track record of advocating for changes in Florida law has resulted in significant annualized savings to residents and enhanced your rights. FLICRA believes strongly in transparency of provider financials, and as a result, Florida has one of the strongest disclosure laws in the country, providing access to community financial statements, expansion plans, and other market trend information. As a resident of a CCRC, you have made a significant investment in your community and the senior living industry. FLICRA ensures the protection of your investment through advocacy and, when necessary, seeking incremental or massive changes to Florida law. FLICRA is only able to carry out its mission with the support of residents like you. Residents can join as an individual, a couple, or two residents in a living unit. Extended family members of residents can also join as affiliate members. By becoming a member, you will earn access to the association's monthly digital newsletter, website resources, and a quarterly print newsletter. Members can also attend local, regional, and state meetings. FLYCRA sends out calls to action when important decisions are being considered by policymakers. These calls to action provide a direct opportunity for residents to engage in grassroots communication to ensure the voice of CCRC residents is heard. Becoming a member of FLYCRA is a worthwhile investment. Annual membership dues are pennies a day. Visit www.flycra.com to join now.
Good morning, Leslie, Resident Services Director here. I just wanted to introduce to you, we have two attendees here from Professional Healthcares of Pinellas. He's a nurse practitioner. His name is Scott, that is able to come to your apartment and be your primary care physician. So let's introduce Scott and Mike, and come on up.
Good morning. As she said, my name is Scott. I'm a nurse practitioner. Usually with an introduction like this, I like to let everyone know a little bit about myself. I was born and raised in Pinellas County. Went to school at the University of Florida and then at USF, where I got my degree in nurse practitioner. I kind of specialize, even though my degree is in adult family, I kind of specialize in the geriatric population. With that being said, I've been in nursing and healthcare since 1998. Part of the reason why I joined professional healthcare a little over 10 years ago is because they had an interesting model. The model is we try to bring healthcare to you. We realized, our founding provider, Dr. Saba, realized that there's kind of a loss in the market. As people get older, transportation gets more difficult. Getting to doctor's appointments becomes more difficult. Getting labs, radiology, various different tests become more difficult. So we tried to institute a component in our practice where we brought care out to the people that had a hard time getting transportation. That's where this model comes in. We come to you, we come to your apartment if necessary. Some of the communities we have offices in, but we always start coming to the apartments to provide that level of care at your home that it gets difficult to get out and get. Once we do that, then we start bringing in services. We can do pharmacy deliveries. We have pharmacies that we work with that do pharmacy deliveries. Like I said, lab services, x-rays. We try to do it all here as much as we can because we understand transportation is difficult. With that, me personally, I'm not a big fan of changing things that are working. If you come and see me and everything's good, I'm not going to go changing medications, doing lab work, doing things just for the sake of doing it. Y'all have made it this far without us meddling. You're obviously doing something right. So our job is to allow you to age in place and just add quality of life to the years that you have. So that's kind of me in a nutshell. Mike, he kind of runs the show. He's the one that puts everything together and gets us where we need to be. If you guys have any questions at any time, if you see me, feel free to stop me and ask me. One thing they did want me to kind of hit on is if I'm in the community and you have something going on, I know that sometimes it's difficult to get to your doctor. Sometimes, there's a month or longer that you have to wait. And, if you have a cold or you have a cough or you're not feeling well, sometimes it's not worth, waiting a month. And one of the things I also like to do is I like to try to limit y'all's stay in the hospital. Hospitals where sick people go. There's a lot of comorbidities that come along with hospital stays. And so we try to treat you in the house before you need to get to the hospital. So you don't necessarily need to change your primary care provider. We can see you as an outpatient kind of, like an emergent care type situation. We can do that as well. As soon as I see you, I send my notes right to your primary care doctor so they're kept up to date with what happened. And the biggest thing for me is to keep you all out of the hospital and keep you as healthy and staying at home as long as possible.
Is there a fee attached to this?
We take almost all insurance plans. There's some that we don't take. We do not take Humana Gold. I do like to put that out there. And then any copays associated with your health plan will be the only fees. Anything else? Yes, ma'am.
How often are you planning on being in the community?
I'm going to start off with probably every other week to start off. And then as demand requires, I'll come more frequently. I have some places I go to twice a week. I have a number of places, a number of sister facilities to this one that I go to weekly. So, yeah, as demand needs, that's how often I'll be here.
Is that regularly, or you can show up if someone's sick?
If someone's sick, the plan is to have a regular day. If somebody's sick and I'm trying to avoid them going to the hospital, I work quite frequently in the Clearwater area, so I can pop in pretty much any day of the week.
How do people contact you?
Through Grace Home Care, I think, is going to, and Leslie are going to be the two best ways to get a hold of me. I hope I didn't speak out of turn, Leslie. Okay, good.
Are they available on the weekends?
Not necessarily. We do have a only because I do hospital rounds on the weekends, so I'm not necessarily available on the weekends. But if you are a registered patient, we do have an on-call service where they can get a hold of either myself or one of us that are on call. So we're always available, just not necessarily for a face-to-face visit. And I do virtual visits as well. All right. Thank you very much for your time. I appreciate it.
Very much. Next up is the President and CEO of Leading Age. Regence Oaks is a proud member and supporter of this organization, and we've asked Steve Ballmer to join us this morning and talk a little bit about the history, the mission of Leading Age, and then to give us a legislative update. So let's give a big Regence Oaks welcome. Steve, we're delighted to have you.
Thank you very much. Can you all hear me okay? Is that close enough?
Yes.
A little higher? Okay, and you're comfortable with my mask being on? All right, great. Listen, this is the first visit I've made, one of the first visits I've made in a year. So even though we've been talking about the rules for 12 months, I haven't had to follow them the way you had to follow them. So thank you, Brant, for having me today. That's okay, that volume? Okay. Thanks for having me. I appreciate the opportunity very much. And thank you all for giving me an opportunity to talk a little bit about Leading Age Florida. As it turns out, I didn't expect to do this, but I'm going to talk maybe as much about FLYCRA as I will about Leading Age Florida. And as I get into that, it's worth noting that I mentioned to your leadership this morning, I do calls with my colleagues from around the country, from the other states around the country, quarterly. And on those calls, someone is always complaining about their relationship with their residents association. Somebody from another state, always. They aren't always excellent partnerships. Florida sets the standard for the rest of the country in terms of the partnership we have with our FLYCRA organization. Bennett Napier is a close friend of mine and an excellent colleague. And when I get to the legislative update, I'll mention one of the many ways that is so important. And one of the reasons I think we've been so successful collaboratively on legislation. But first, let me introduce myself just a little bit. I could dive right into the policy stuff, but maybe something about me before I go too far. Unlike the folks who just spoke, I am not originally from Pinellas County. I'm originally from Laramie County, Wyoming. So I'm the one person you know from Wyoming. If you get a call and you have a 307 area code on your cell phone, it's likely to be me. You know someone from Wyoming? You do? Good. All right. There's about 500,000 of us, so the odds are that you'll know someone eventually. But my family and I have 6 children, and we moved out here almost 6 years ago now. And it doesn't really, the first question is why, people from Florida tend to say, why would you leave Wyoming? It's wide open, the weather's perfect, there are no people, there's no crime, there's no smog, there's no traffic. There was 31 inches of snow in my hometown last weekend. So that's why I live in Florida. And I'm never shoveling a sidewalk again as long as I live. I'm sure you can understand. So very happy to be here. I came here to do this work. My grandmother was a Presbyterian minister. She was actually the first woman ordained Presbyterian minister in the history of Wyoming, a little bit of a pioneer. And she died in a nursing home in Wyoming with Alzheimer's. And it was not a terrific experience. It was a horrific experience. And I remember thinking, we can do better than that. And I want to be part of the solution. So I ran a consulting company out there. I represented Leading Age Wyoming, if you can imagine. All 38 Wyoming nursing homes were members. We have 700 nursing homes in Florida. And look forward to the opportunity to come here, live in this paradise that we all get to live in, and do this work on your behalf and with partners like Brant and Regency Oaks. So just a little background. Is it okay? I know we're broadcasting this, but it's okay if I move around just a little bit?
No, I'll move with you.
You will? Okay. I come from a family of preachers. Standing still is going to be hard for me to do. Just a little bit of background on Leading Age Florida. So we are in our 58th year. We were originally founded to represent largely nonprofit providers of aging services, mostly nursing homes at the time. In that 58 years, things have changed just a little bit. Now, we're the only association in Florida that represents the entire continuum of care for aging services. So we represent affordable housing for low-income seniors, and we have a lot of that actually in the St. Pete area, but South Florida especially. Assisted living providers, nursing homes, and then of course CCRCs. We're the only association in Florida that represents CCRCs or life plan communities. And I noticed in the video, which I love by the way, well done video, there are 71 CCRCs in Florida today, and 64 of them are members of Leading Age Florida. So we don't quite have the market cornered, but we're not done. We will get the market cornered before it's all over. And our mission, as Brant said, it's really very straightforward. Advocate, educate, serve. And I'll get to the advocate part in just a moment. We'll talk a little bit about the legislature before I wrap up. Education is continuing education, ongoing professional development. But it's the serve part that I think I want to spend a moment talking about this morning. And that's because part of the invitation for me to come speak today is just say a little bit about what you've been doing. Current events, current happenings at Leading Age Florida. Well, the things that we've been doing at Leading Age Florida are almost exactly the same thing that you've been doing for the last 12 months. It's been all COVID all the time, as you can imagine. I was on a plane to D.C. get a little feedback. I was on a plane to D.C. in February of last year, and we had just started hearing rumblings about this virus in China. And my vice president of public policy said to me, I'm not so sure I feel good about getting on an airplane. And I said, China, we're okay, right? Many of us were there a year ago. This isn't going to be a big deal. It'll be a few weeks. Pretty much all we've done for the last 12 months, 24 hours a day, 7 days a week, is serve. And serve our members in dealing with COVID-19. So just as some examples, we started doing daily phone calls. We have about 250 members total, all across all those categories that I mentioned. But because many of them are like Regency Oaks, where there are multiple levels of care on a single campus, we actually represent about 500 buildings. We started last March doing phone calls for all of our members 7 days a week. So we'd have 500 or 1,000 people on the phone every day of the week dealing with the changing regulations, the changing federal orders and directives. Of course, the state orders and directives changed almost daily. We have this example. It's hard to believe now, but there was a CMS order, a regulation that came out last spring. It changed 6 times in 3 weeks. So all the folks who work at Regency Oaks, who were doing everything they could to prevent the virus from getting in, to prevent the spread and that sort of thing, were dealing in an environment where the rules literally changed day to day. So we've done over 170 of those phone calls now. We did them 7 days a week. We started out, it was so rudimentary when we started, it was just a conference call, and we couldn't mute everyone. So you all remember the Supreme Court hearing from last spring when we heard one of the justices toilet flush in the background. We had that. We had a woman chasing her dog around in the backyard, yelling at him over trying to explain CMS regulations and that sort of thing. But hundreds of those calls now to try to make sure that our members had all the information they need, to try to help interpret all of the flood of information that was coming out. There have been over 350 sets of directives, orders, regulations, guidance at the federal and state level that our members have had to try to balance and figure out how to deal with in the last year. So it's been an enormous undertaking. The good news is, and I sometimes wonder, I look at Brant and I look at his team, and they are the people who have been doing the work for the last 12 months. My team and I sit in an office in Tallahassee and push paper around. We try to interpret regulation, and we try to make sure we understand what the latest information is and make sure our members have it. But we weren't on the ground taking care of residents. We weren't the ones implementing the challenging kind of rules and regulations that they had to implement. But I think every minute that we were able to help save our members not digging through paperwork from the federal government is a minute they were able to spend serving you. And in that way, I think we've been able to provide some service. We think of the pandemic in 4 phases. First, there was the PPE phase. We all remember the PPE phase when global supply chains were choked. You couldn't get PPE. We had members whose masks and gowns were hand-sewn masks, shower caps, and trash bags. And they sent us pictures of their clinical staff trying to serve residents literally gowned in trash bags. It was that bad. We finally got through PPE, as you all remember, and then we went to the testing phase. Everybody remembers the testing phase. I know you do. We heard from some of you. You couldn't get testing either. And of course, it was a really bumpy rollout. It was slow. When you could get testing, we weren't sure we could trust the results, if you could get testing at all. Remember the days? I've been telling the legislature for a month now, it's hard now for the general public to remember how little we knew 12 months ago. Remember when you would get a PCR test and it would take 14 days to get your results back? And by then you're out of the gestation period of the virus anyway, so the test didn't really matter. We did that for several months. Then we went into the visitation phase. And I know you all know about the visitation phase, where our member buildings were locked down with good reason. It was a difficult decision, but with good reason, visitation was prevented. I was just having a conversation with your leadership this morning. Visitation's open again, right? We're phasing back in and doing it in as smart and as reasonable and safe a way as we can. But how wonderful is that? That people are able to come back on campus and visit with you, and you can visit with your family members. The amount of time we spent watching visits, people visiting through windows, via FaceTime. Who here is a FaceTime expert, by the way? Yeah, I thought there would be a few. We're all good at Zoom now, right? 12 months ago, we hadn't heard of Zoom, and now that's all we do. We do Zoom. I actually Zoomed with Brant a few weeks ago. And then we got into the vaccine phase. And this is the real light at the end of the tunnel. And so we've been managing with our members all the way through. We were able to help get vaccines out to places where they weren't arriving. We were able to help work with CVS and Walgreens and CDR and the National Guard strike teams and the governor's office and everybody else to try to get vaccines out to people who desperately needed them. And I understand you're all vaccinated. The vaccine process here went very smoothly, and what a blessing it is to know that we've got the vaccine on board and we can start moving back into life as normal. I'm not fully vaccinated. I got my first shot last Friday in Tallahassee, and I woke up, you'll all be able to relate to this. I woke up on Saturday morning and I thought, what did I do? Clearly I don't exercise. I didn't do anything that would have caused my shoulder to be sore. It was that dang shot. So anyway, the vaccine is the light at the end of the tunnel. We are still helping members with vaccines. I don't think you have those challenges, except the population isn't static, right? There are new staff members, there are new residents, there are new folks across the campus coming in, and so we're still working on solutions for that. But my goodness, what a year. What an incredible 12 months, and what an opportunity for us, I think, as my grandmother taught me, just be of service. Just be of service. And what an incredible opportunity for us to do that. We are looking forward now. Post-pandemic, and so we're working with FLYCRA on what will the new world look like. Of all the things we did and all the things we learned and dealt with in the last 12 months, some of that's going to stay, probably. So what components of that will stay with us into the future? What components will go away? I'm afraid to say, but I think Zoom is probably with us to stay, although it was nice to get in my car and drive out of Tallahassee yesterday. It's also nice to be able to do meetings with people across the country via Zoom. I think some of those things probably won't go away. But we're working with FLYCRA on some education and some opportunities to help our members see around the corner just a little bit and understand how the environment may have been permanently changed as a result of COVID, and for the better, we hope. So let me dive into our legislative work very quickly, and then I'll stop and see if we have any questions. Our legislative work is probably the area where we spend the most time working with FLYCRA. And our number one priority is a shared priority that FLYCRA has helped us with a lot. In fact, You may have seen a few weeks ago there was an opinion piece in the Tampa Bay Times about COVID-related liability protections for long-term care providers, and it was co-written by yours truly and Bennett Napier from FLICRA. So we work together a lot on legislative issues. FLICRA's been very supportive on our top priority, which is the COVID liability protection bill. I'm happy to report, I know that you're all up on the news, but I'm happy to report that the Senate passed our liability bill last Thursday, I think. And now the bill goes to the House, which we expect will pass on Thursday or Friday of this week, and then we'll go to the governor's office. So we think we're just about there in terms of getting thoughtful, reasonable, measured COVID liability protections in place for providers. And all the context I just described about the environment that Regency Oaks and others have been operating in for the last 12 months, those are the reasons that liability protection are so important from our perspective. It wasn't a practical impossibility. It was an actual impossibility to follow all the guidelines simultaneously. Think about that. The federal government says you have to do things this way. The state government says, no, you have to do them this way. And your folks have to figure out which of those will we follow and what penalty are we willing to accept if we get written up for doing it the wrong way. We have a terrific example in front of us right now. You are all aware, of course, that visitation began opening up in Florida in September of last year, although, again, it's been a slow process. 2 weeks ago, CMS issued new guidelines for visitation. The guidelines from CMS are different from the state's order about visitation. So we're either following what CMS said or we're following what the state said, but in either case, we're out of compliance. So that's really been the nature of the environment for the last year. So we see this liability protection from two perspectives. First of all, it's what providers need so that they can continue doing the work that they need to do in this ever-changing, difficult environment without worrying about what often are, I know I should have surveyed everybody for their political affiliations before I got into this, and your professional backgrounds, because I may get into a little hot water here. But we already know there are over 100 lawsuits that have been filed against providers in Florida. That number jumps by about 10 to 15 lawsuits a week. And many of those are opportunistic. They're sue and settle, right? You know how that works. You file a lawsuit against a provider, you make them spend a lot of money defending it, and then after they've spent all that money, you sue and you settle and the case goes away. And everybody has a right to sue, and this bill won't prevent anybody from having the opportunity to sue. One of the things, I learned this from a mentor of mine in Washington, D.C. at Leading Age National a few years ago. At Leading Age, we believe in two kinds of providers: the good and the gone. It's that simple. There is no excuse for providing substandard, subpar care for residents in Florida or anywhere else in the country. So we've never been in a position of trying to prevent providers who should be sued for being negligent from being sued. We've never been in a position to try to prevent residents from having that right. What we do want to prevent is those sue and settle opportunistic lawsuits that will drive up fees for you, which is where we met. That's the nexus between us and FLICRA. We have this shared and now kind of obvious understanding. Without residents, there are no CCRCs. And if there are no CCRCs, where will the residents go? And so Bennett and I work on political issues from that perspective all the time. And this was an easy opportunity for us to say, look, if we can prevent the system from being clogged with unnecessary opportunistic lawsuits, we can also prevent the trickle-down effect of those lawsuits from getting to all of you. So we think it's a good bill. We think it's reasonable and thoughtful. We think it provides the right kind of protections that the leadership in your community needs so they can keep serving you. And it protects residents' right to sue if there's a provider who's been truly negligent. So we'll keep our fingers crossed. I'm on the road visiting your sister communities all this week, so I expect the bill will pass in the House while I'm on the road. Nevertheless, through the magic of modern technology, you will see a press release go out from me on Thursday, thanking the House for their support and urging the governor to go ahead and sign that bill. One last item on the legislative front, and then I'll stop and see if there are questions or issues you'd like to talk about. You may have heard of a program. It's called the Personal Care Attendant Program. As you know, especially last spring and summer at the peak of the pandemic, it was difficult for our provider members to get staff. Some staff left and didn't come back because they were afraid of working in conditions where they might get the virus. Some staff did get the virus and couldn't come back. And then, of course, because of the context of all that, it was difficult to recruit and retain new folks. So in the midst of all of that, we created a new program, this personal care attendant program. And it's basically, if you think about it as a support role for a certified nursing assistant, it's a way for folks to get into the pipeline. It's a career path so that we can go out and hire people and get them into long-term care as a career opportunity, to learn what it's like to be a CNA and to serve seniors in that environment, and to help out with kind of the lower level tasks, making beds, picking up food trays, those kinds of things. So the clinical work will still be done by the people who are clinically trained, but this is a way for us to get some support for those folks, try to remove some of that burden, and help them out so that they have more time to spend delivering clinical care and dealing with that part of their work. So as with everything, the liability bill has been taking a shellacking. There are groups out there who think we're trying to upend the system and that it's the worst thing that's ever happened in the Florida legislature. There are groups out there who think this PCA bill is similarly detrimental. But the truth is, we think it's an opportunity to create a career path, to get some people some experience, and to support the staff that's been doing such an excellent job here and at other communities across the state. So that's our PCA bill. It is flying through the legislature, which is good news. And hopefully in the next couple of weeks, we'll have that program in place. That makes it permanent. And then we can really start recruiting these folks and getting them into the pipeline and getting their help. So probably a little bit into the policy weeds. So I apologize for that if that's the case. But those are really our two biggest issues. Everything else is about the budget. And this is the beginning of week 4 of the legislature. So they'll really start getting into budget issues and Medicaid and all kinds of things down the road. Happy to talk about the budget and Medicaid if that's something that you're interested in hearing about. But I think what I'll do is stop there and see if there are questions or concerns, other issues you'd like to talk about that I can address while I'm here. Sure.
What about the bed tax?
Hold on just one second.
Oh, sorry about that. I got ahead of us.
This way we'll capture it on the TV.
What about the bed tax? You think that's going to stay dead? Or is that going to, well, you know of anything that's being discussed about it?
That's a great question. Thank you for that. So CCRCs in Florida are exempt from the bed tax, as you know, so it doesn't apply here. Last year there was an effort in Congress, actually. This all ties together. Thank you for the segue. There was an effort in Congress last year to eliminate that exemption, which would make CCRCs subject to the bed tax. Bless you. That's actually the flight I was on last February when we started hearing about COVID. We went to Congress, and specifically the members of the Florida delegation, and we said, you understand this means hundreds of thousands, in some cases millions of dollars in new taxes for senior living providers in Florida if this exemption goes away. We managed to get every member of the Florida congressional delegation to sign on to our opposition. And actually I think it was in January of this year, CMS has finally once and for all said that discussion is off the table. So it's over. That exemption remains, and we don't hear any discussion in the Florida legislature about trying to do anything with that.
Thank you.
That's really good news.
Yeah, thank you. And I should say, I mean, I don't mean to overdo this, but I think it's important to make sure we share credit where credit is due, and FLICRA was a significant element. We sent out messages to our member communities, and we said, look, I suspect your residents won't be excited to pay $1 million in new taxes or fees associated with new taxes. And we had thousands of letters from FLICRA member residents that got sent to Congress as well. So we didn't do it alone, but it is done, and that is good news. Thanks for the question. Other questions? All right.
Pretty good video. What do you think?
I think the FLICRA video is excellent. It's excellent. I've already emailed Bennett about that. I hope it helps with new recruits. And if you have a chance, though, visit leadingageflorida.org. We have some good videos up there, some good resources. Our convention is coming up this summer, and that's the opportunity we have to recognize our members who have really gone above and beyond and done outstanding work. So if you go visit our website, you'll see videos where we in very much similar fashion, recognize clinical providers, leadership, residents and volunteers, and others who have just really done outstanding work. So I'd encourage you to visit leadingageflorida.org, and if there aren't other questions, please don't hesitate to track me down if there's anything you need. If we can be of service in any way, or send Bennett after me. He knows where to get me, and we talk often. So thank you very much for the opportunity to be here. I appreciate it.
All right, Steve, thank you so much. We truly appreciate you being here and all the efforts that you've lent your hand with over this past year. There was a time back when we were trying to get the vaccine clinic scheduled that I just was losing my mind, and placed a phone call after a couple of more stressful emails than what they needed to be, and literally he walked me off the edge and was instrumental in helping us get this accomplished. So it wouldn't have happened without your support, and thank you so much for your efforts there. And that's it for today. Thank you so much for running a few minutes over, and go and have a great day. Thanks.